Hi, everybody. This is Dr. Hall. Welcome to Lecture 25, Pharmacology. This is a really quick snapshot of just a few key things in pharmacology that I thought would be useful to include for our neuroscience course. So when we look at the outline for this lecture, we're going to talk quite a bit about routes of administration, which is how you actually get a drug into your body. And then we're going to talk a little bit about pharmacodynamics, or what are the things that impact then how the drug behaves in your body and what it's actually going to do to you or for you. So we're going to start with routes of administration, and we're going to start with oral routes. So it's often called PO, per oris, coming from the Latin, which means by mouth. So when you swallow a medication. So that's the first part that we're going to talk about. Before we get into it, let's be clear about what a drug is. So I'm going to use the word drug because it's quick and easy to type. So a drug can be a pharmaceutical substance or a recreational substance, right? So the Claritin that I forgot to take this morning, so I might be a bit sneezy today, which is an over-the-counter pharmaceutical, right? Or the prescription blood pressure medicine that my dad takes, or it could be the caffeine in your beverage of choice. Caffeine is a drug. So all these things have in common is it's an exogenous substance. Exogenous means coming from outside of the body, that then is introduced inside of the body to have some sort of an effect, right? It's going to change your physiology in some way. Could be hydrocodone, right? So it could be a prescription pain medicine, or I thought this photo was hysterical, right? So I think every potential recreational drug is shown here, although that is not what a line of cocaine normally looks like when somebody's going to do it. Not that I know from personal experience, that is not a drug I would ever try. But we have like everything under the sun present here, and then, the sister or the girlfriend is just like, right. Okay, so we've got alcohol, we've got, looks like some marijuana there, some cocaine, a variety of pills, you name it, he's got it on the table there. I just thought that was so funny. So how do we get it in the body? So we could use the digestive system. The digestive system is the system that we have for getting outside stuff into our body in terms of nutrients, yes? And so we can definitely use that one, pretty convenient. We can also use the respiratory system. That's usually how we get oxygen in and carbon dioxide out, but we can also use that for drug delivery, especially if it's a gas drug, which some are. Our circulatory system is, we can go right into the circulatory system like with an IV basically an IV. But let's also think about the fact that almost all the time we're going to end up using the circulatory system to distribute the drug throughout our body in order as the transportation system to get it to where we want it to actually have its action. We can also get things into our body through the skin, so we'll talk about that. And then you can also get things into your body through your eyeballs and in your ear and in your vagina and other places. So we're not going to talk as much about those. So we're going to start with oral administration or swallowing. So we're using the digestive system, easy peasy lemon squeezy. It's very convenient. It might take you a little time to learn how to swallow a pill, especially if it's a big pill, but it doesn't require any special equipment. As long as you can get a formulation of the drug or substance that somebody can swallow, you're good. So you don't have to make sure it's sterile. You don't have to make sure it can be drawn up into a syringe, right? As long as you can swallow it, you're good. So this is all awesome and is the reason why most of the medications and many of the drugs that we take, we ingest orally. But there are a few tricky aspects that people who design drugs or work with drugs, so people who are doing research in pharmaceuticals or people who are working clinically in pharmacy, need to be really aware of when we're taking things orally. One is, are we going to digest it too much, right? So our digestive system breaks molecules down into their smaller components so that then they are small enough for us to absorb them. Now, some drugs cannot survive those processes long enough to get absorbed into our bodies. So an example would be insulin. Insulin is a hormone that is made, it's a peptide, so it's a string of amino acids. guess what we have right away in our stomach? An enzyme called pepsin, which breaks apart peptides, right? So the problem with insulin is you can't take it orally. People wish you could, right? Which is why insulin is given by injection, because we have to bypass the system because it's not going to make it, through the stomach or certainly through the first part of the small intestine. This is why perhaps you've been hearing in the news a lot about other kinds of peptides that are being marketed for all kinds of crazy things with often very little evidence and very little human trials. So just so you're aware, some of the stuff has been researched and shown to be safe and effective, and some of it has not. But any type of peptide drug or medication or whatever you want to describe it as that you're going to be taking cannot be ingested through the mouth. Your digestive system would obliterate it before you could even absorb it. So then the other question is, well, maybe it can survive digestive processes, but it's too big or clunky a molecule to then get absorbed into our body. So what normally happens is that a drug, a substance, a nutrient gets absorbed across the wall of our intestines and into the blood vessels there, and then it's in our circulatory system and goes through the rest of our body. Some drugs we just can't absorb them. So one example is an antibiotic called vancomycin. And it's this weird molecule. We can't absorb it. So if you need to get it throughout somebody's entire body, say they have sepsis, or they have an infection in their heart valve, or they have an infection in their bone, that's osteomyelitis there. If you need to get it to their whole body or to something inside their body, you have to give it IV. You have to give it directly into their circulatory system. But if you're treating an infection that's inside the intestines, you can actually give it orally because you can't absorb it, so it just stays inside the intestine, but that's where the infection is, so it's kind of genius. It's kind of perfect. So vancomycin is a really interesting one in that sometimes we give it IV to reach the parts of the body that require the circulatory system to deliver it there, and sometimes we give it PO or orally if we're treating something that's on the inside of the intestines. I thought that was kind of cool. The next question, so will it survive digestion? Can it be absorbed? And then the next question is, will it survive something called first pass metabolism? Huh? Yeah, it's the first time you're hearing that. So this is how our body screens out and deals with all the things that we eat and absorb before it kind of goes to our brain, goes to our heart, goes to all the other parts of our body. So if you had a Quick Trip breakfast sandwich this morning, you had a whole heck of a lot of cholesterol and fats, and maybe you washed it down with, I don't know, a chocolate milk, which also had like a ton of sugar in it. And those concentrations of fats and sugars, maybe, I don't know, maybe last night you had some alcohol, right? All of those things, those are concentrations that your body does not want going into the general circulation. So our liver actually is going to process the blood that is bringing stuff that we've absorbed from our intestinal systems. Our liver is going to process that and kind of store stuff or detoxify it or metabolize it for us. So from anatomy and physiology, you may remember learning about the hepatic portal system. In case you didn't remember, we're going to do a little review. So everything that we ingest, right, that can get absorbed is going to get absorbed. So if I'm like, let me get my little pen here. So let's say I eat a bunch of crap, comes into my stomach, goes down into my intestines. Yes, so here it comes. And then it gets absorbed into the bloodstream. So here's some capillaries that are going to go into veins. And then those veins drain, so now I'm in the bloodstream, all the way up and into what's called the hepatic portal vein. So here's this, if it gets this far in the intestines, it's going to go this way, and then again into the hepatic portal vein. And so all this blood then comes to the liver for detoxification and processing. So if I I just ate a bunch of M&Ms, to be honest. And so there was a whole bunch of glucose that came in through my hepatic portal vein into my liver. And my liver was like, we do not need this much glucose in our general circulation. So we're going to take a whole bunch of it and we're going to store it as glycogen, you might remember, right? So store it so that we don't have such a high blood sugar level right away out the get-go. So then after the liver is done processing it, the blood is going to move through hepatic veins and into the inferior vena cava, and now it is part of the general circulation. So you might remember the inferior vena cava is then going to drain into the right atrium, then right ventricle, then out to the lungs, then left atrium, left ventricle, and then out to the whole body, including the brain. Okay, so only after the liver processes the blood coming from our intestines does it get dumped into like the general circulation. So all of that blood coming from our digestive system has to go to the liver first for processing to make sure that everything is okay before it goes to the rest of our body. Now, obviously, this does not remove everything. If it did, you could never get drunk, right? So it is kind of often referred as this first pass metabolism. There will be bits that we didn't get that we're going to clean up later. So first pass metabolism. So this is a very simplistic diagram, right? So stuff that you eat or drugs that you take come into the stomach and into the intestines and then gets absorbed into the blood that goes through the hepatic portal vein into the liver and gets metabolized, might get completely destroyed, might get modified or altered, and then after that, then the blood goes into the general circulation with whatever we've done to that particular drug or agent. Now, one cool thing is that this activity of the liver, which depends on all these really cool enzymes that the liver has, sometimes can be modified by certain foods and drugs. So you may or may not know that people taking certain medications are cautioned not to drink grapefruit juice. Now, so the interesting thing is that grapefruit juice inhibits or decreases the activity of some of these liver enzymes. And so what happens is that the liver is not able to metabolize and get rid of as much of certain drugs in that first pass metabolism as it normally would. So what can happen then is then you get too much drug entering the general circulation because you've decreased first pass metabolism. So that's something that some people need to know, right? And there are some medications that can do that as well. So when we think about drug-drug interactions, how drugs or foods might affect liver metabolism, that first pass metabolism, usually through a family of enzymes called the cytochrome P450 system, that is something that we need to be very cognizant of. On the flip side, sometimes the liver can actually do things that are for our benefit. So we just talked about how the liver can destroy some of a drug. So usually the amount that goes into your general circulation is a far lower concentration than what you absorbed from your intestines because the liver just gets rid of a whole bunch of it. But sometimes the liver's enzymes will change a molecule in such a way that it changes it from an inactive substance, a physiologically inactive substance, to an active substance. And so when that happens, that's called a prodrug. So an example of a prodrug would be tamoxifen, which I'm showing you here. Tamoxifen, which is a breast cancer treatment and prevention drug. And when you take tamoxifen and you swallow it and it gets absorbed into your blood vessels and then goes through the hepatic portal vein into the liver, it isn't actually biologically active. It's not going to do anything. If I took that same tamoxifen and I injected it into my bloodstream, it's not going to do anything. But what happens is when it goes to the liver, I have these enzymes. These are little enzymes here. And they work on that molecule and they end up turning it into something called endoxifen. And it turns out that endoxifen can bind to estrogen receptors and actually do the work of the drug. So that's kind of cool. So when we take it, it's in basically an inactive form, and then the liver converts it into the active drug. So it's kind of interesting. So different people have different activity levels of these different enzymes. It's genetic. And so for example, I happen to be on tamoxifen, and when we were figuring out what dose I should take, one of the things we did was we did genetic testing to see what my genes for these enzyme levels were like. And it turned out they're normal, so that's fine. So my liver should be able to convert tamoxifen to endoxifen, no problem. If I had low activity of those enzymes, however, then they would have given me a higher dose because I would have been less able to convert tamoxifen into the active medication. Isn't that cool? It's kind of cool. All right. So in summary, oral administration, right? So we've got drugs. These are exogenous substances that we're bringing into the body because they're going to impact our physiology in some way, shape, or form. And when we talk about route of administration, we're just talking about how do we get it into our body, into our system. Our end goal is to get into the bloodstream because the bloodstream is the natural transportation network in the body, and that's going to go to all the different body parts. And so we'll be able to get the drug where we want it. Oral administration is easy and convenient. There's no special equipment needed. The drug doesn't need to be sterile. And you often get kind of a gradual onset and a long-lasting effect, a longer-lasting effect than if you give the drug through other methods. But there are challenges. Is the drug going to get digested and broken apart in the stomach or intestines before you even absorb it? If so, this method is not going to work, like for insulin or other peptides. Can it even be absorbed, or is it just too unwieldy of a molecule for us to bring it into our body, like vancomycin? And then what happens to the drug with first-pass metabolism by the liver? Because if we're swallowing it, it gets absorbed from our intestines. It's going to the liver for processing before it can get into the general circulation. So is the liver going to degrade the drug and decrease our overall concentrations? And if so, by how much? So how much drug do we need to give in order to get enough into the general circulation? Or is it going to obliterate it completely so we can't even give this medicine that way? Or is the liver going to help us out and take an inactive molecule and convert it to an active molecule that will actually do the effect for us? And that's what prodrugs are. So taking a pill seems really, really simple, but it is actually one of the most complicated routes of administration when we're looking at what actually happens after you swallow it, and is the drug going to get where you want it to go in the concentrations that you want to see it. All right, that's it for 25A.